Multiple sclerosis treatment with physical therapy. Multiple sclerosis, MS, is a progressive neurologic disease that damages the nerves. This damage often leads to serious symptoms, such as the following: numbness and tingling, weakness, muscle pain. Learn how to support and cope with your changing body. Avoid exacerbating symptoms. Develop strength and stamina. Regain abilities after a disease relapse. A discussion with a physical therapist can help you understand how your body will change as the disease progresses. Getting PT can help you prepare for these changes and help you maintain or improve a healthy lifestyle. Physical therapy at different MS stages. PT may be helpful at various stages of your condition, and for different types of MS at diagnosis. At the time of your MS diagnosis, it's important to meet with a physical therapist for a baseline evaluation. This exam allows the therapist to see what your body is capable of now so they can compare that with your future abilities. You can also discuss your physical limitations and understand what levels of exercise and physical activity are appropriate for you. After the initial exam, you may not need to continue seeing a physical therapist. But, you'll likely want to continue with PT if you have an aggressive, rapidly progressing type of MS during a relapse. A relapse, also called a flare or exacerbation, is a period of time when symptoms of MS are more frequent or severe. During this period, you may have greater difficulty with everyday tasks that include working, cooking, walking, bathing. Your physical therapist will know how the relapse is affecting you by conducting a physical exam and comparing it with your baseline evaluation. After a relapse, you should meet with your physical therapist to resume PT. Therapy after a relapse may help you regain some of the strength you might have lost during the relapse. For progressive multiple sclerosis, if you have primary progressive MS, you don't experience relapses. Instead, your disease is on a gradual, constant decline. If you're diagnosed with this type of MS, ask your doctor to refer you to a physical therapist right away. It's crucial to your health and well-being that you start PT as soon as you can. PT can teach you how to compensate for the changes you'll experience. You may also need to learn how to use a mobility aid, such as a standing device or wheelchair. People with advanced MS can still benefit from PT. For instance, PT can help you learn to sit properly, develop upper body strength, and maintain the ability to use mobility aids. Where you'll have physical therapy. Physical therapy can be done in several locations that include your home, an outpatient facility, and MS treatment center. PT for MS may be different based on where it's provided. In some cases, the stage of the disease determines where you should have your PT. In other cases, you may be able to select the option that works best for you. Inpatient PT. You'll receive inpatient care while you're staying at a healthcare facility. PT conducted in an inpatient facility is often done in a hospital, MS treatment center, or long-term care facility. Most people who require inpatient PT have experienced a fall or some type of injury due to MS. People with advanced stage MS may also be living in an assisted living center, and PT may be required as part of treatment. Outpatient PT. Outpatient care takes place in a doctor's office, physical therapy office, or therapy center. People who have outpatient PT come to the venue for therapy and leave afterward. Outpatient PT can be a good choice for people who are recovering from a relapse or learning to handle the physical changes MS causes. Home care. With home care, a physical therapist will come to your home to provide PT. People in all stages of MS can use home care. This type of therapy may be especially useful for people who've been recently diagnosed with MS and are learning to deal with slight changes in their physical abilities. Home care can also be good for people who have late-stage MS and are non-ambulatory. Making your treatment plan. If you have MS, talk with your doctor about your course of treatment. If you would like to begin working with a physical therapist, ask your doctor for a referral. MS is different for everyone, and some people may respond well to certain exercises while others won't. Be honest with your doctor and your therapist about your symptoms and how you're feeling so that they can create a PT program that's right for you.